so I started to find it kind of useful to look at formulas in this sort of way. So, for example, you could do a similar sort of thing with Xiao Chai Hu Tang, where we have, and then we have Huang Qin, and then we have Ren Shen or Dong Shen, the Qi tonic that's in the formula. These are a pair. The Chai Hu lifting up and out and breaking Qi stagnation and the like, and the Ren Shen helping to support that by giving more force to the Qi. The Chai Hu and the Huang Qin, that's sort of like the Guizhi and the Xiaoyao being those sort of opposite natures, where one is more upward and outward and warm, and the other is more downward and cold. And so they really balance that aspect of the Qi. And then the Huang Qin and Ren Shen are similarly paired in that way. So you see this sort of three herb kind of all related dynamic in it. And for me to understand herb formulas a lot of times, to see what's sort of creating the Qi movement in the body. Hence the saying, these simple, more classical formulas, it's always better to modify them by adding to them than by taking anything out. Because when you take something out, you're really at risk of stopping the Qi mechanism that the formula was trying to create. And so I found it to be so useful in my treatment approach, is to always think about how do I really try to reestablish the Qi mechanism in the body. Get things, because if the Qi is regulating, the body fixes itself. And if the Qi is not regulating, so it gets away from this idea, I just have to, not really, I just have to make the Qi regulate again. Then the person fixes themselves. And so I'm always concerned about trying to provoke that Qi mechanism in the body. And we can see this sort of interaction in these simple formulas. So let's look at so we had that one case, we used the Guizhi Tang. Let me give another case here. I didn't put it on the overhead. But this is the 3.5-year-old boy. And he was brought in, and the complaints were he was having some restless sleep. He was very easily startled. Like things would startle and shock him, and he was fearful. And he was kind of a little over-emotional. He would cry very easily. Somewhat pale color. Now, when I looked at his tongue, though, his tongue was somewhat red. And his pulse was, kids by nature have a fast pulse. I would say that it's hard to classify exactly a 3.5-year-old pulsing, but I would say it was kind of a weak but fast pulse. So in a way, he looked a little bit like this Guizhi Tang type. He was pale and emotional, but he wasn't particularly thin. He wasn't particularly cold. If anything, he tended to go towards a little bit the heat side of things, right? He had a little more red on the tongue. His pulse was fast, as kids' pulses are prone to be, but, And the kicker here was he had a good appetite. So you can see this is a little different. It doesn't quite fit the Guizhi Tang type. I used with him Gan Mai Da Zao. This is easy to put on the Bermuda Triangle here because there's only 3 herbs represented in the formula, right? You have the Fu Xiao Mai or Huai Xiao Mai, one of the wheats, and then you have Gan Sao and Da Zao in it. So simple, almost seeming like nothing, but this is a very anxiety formula for somebody who's a little deficient, but not extremely deficient anywhere, and has a little heat harassing the heart. It's sort of astringent, it pulls the heat back to where it belongs, calms the heart, and this worked wonders for him. He started to sleep better, he was less emotional, cried a lot less. And what's the tip-off here that I really wanted to target the fire is his age was kind of a tip-off. Around the toddler time, kids, we say, are in the wood phase of development. And then they have to make a fire, where they start to become more socially engaged, playing with other kids, and so forth. And if they have difficulty making that transition, you often see these kind of issues occur, these kind of over-emotionality issues and lack of cooperativeness, stuff like that. And so a formula that sort of targets directly and calms down. Many Chinese medicine pediatricians say that Ganmai Da Zao Tang is like a key pediatric formula. It just stabilizes kids and makes them less emotional and easier going and less anxious and less fearful. And simple formula works. And in fact, this formula, there's actually studies done in China. Schizophrenics who aren't responding well to their meds, their Western meds, if you give them this formula, their meds start to work. And so this formula is seemingly almost no danger of interaction with your meds or anything. It's just such an easy prescription to just sort of blanket prescribe, but it sort of stabilizes the mind in a way that they just do better on their meds. So when you're having somebody who's maybe had schizophrenic episodes, is pretty well controlled with their meds, but now somehow they're having trouble balancing the meds, they're starting to have, behavior changes, and you can always just almost at random prescribe Ganmai Da Zao Tang, and the meds start to work. So if your goal isn't to get them off the med, more stable again. Here's a way of. Anyway, we'll talk about this in a little more detail in a minute about these developmental stages, just because that's sort of important for any mental disturbance in kids. But so the difference here between our initial case, Guizhi fit, this case, this kid I didn't see the deficiency. How about if instead of this presentation as I described it, he had also had poor appetite, he was also thin and not gaining weight. Maybe he had cold hands and feet. Itself probably wouldn't have been sufficient. In fact, this is the description then where we would go from Guizhi to Xiaojianzhang Tang. Minor construct the middle formula. This one relights fire under the spleen and therefore helps you to start to digest and make substance again, and is still very emotionally calming. So like if you have a kind of a colicky baby who's has no appetite and is not gaining weight and stuff, this is a perfect choice for that kid. Let's look at the Xiaojianzhang Tang is, we should put it up here, is like the Guizhi Tang, same two herbs at the top. You have Guizhi and Xiaoyao, but this time the amount of Xiaoyao is much bigger. So what it's doing is it has a little more internalizing and tonifying effect. And then instead of sitting on the gansao as sort of the pivot, it sits on the etang, barley malt. And the barley malt is sweet and nourishing to the spleen and really even more. And so they say that the effect of this is to take the heat that the Guizhi redirects and make sure it goes to the spleen and make the digestion build again. You can think of this formula same way in, I must say, and I don't mean this to be sexist in any way, I tend to see this more in female patients. But if you have an adult female patient who's underweight, can't gain weight, has no appetite, often is eating the wrong diet, they're always attracted to eating very light foods. Oh, always have to eat a little salad. Yeah, they really like salad, this person. And yet they're cold, they're thin, they're a little pale, and they're very emotionally sensitive. They often respond very well to Xiaojianzhang. And the spleen gets, and they'll actually feel comfortable eating a wider foods. We should differentiate this from this. I'm not talking about body dysmorphic disorders where the person is thin and feels fat. That's a different issue. In fact, it sort of leads us into our. We mentioned Xiaochaihu Tang here. We say that in general, body dysmorphic disorders where the person feels bigger than they are is liver stagnation. We can think about, there's actually a very specific formula for moving that particular kind of liver stagnation. Xuan Fu Hua Tang. Xuan Fu Hua is the only flower that has a descending action. We'll look at that formula in a minute. It gets rid of that kind of sensation that the person feels, I feel big, even when they're not. That's a useful thing. We'll try to understand that in that formula in a little while. But anyway, so how about instead of this whole presentation again is a response to Andrew's thing. Let's see about doing some case differentiations. You want to look at these little differences like that. Who does better with Ganmai Dazaltan? Usually it's not doing a whole lot for the digestion. There's usually not stuff like that. Xiao Zhenjiang Tang better for, we mentioned Xiao Chaihu Tang now in there just in the terms of its balance. That's really good when there's a pathogen stuck in the body and generating heat. For example, how about a kid who has so-called impulse control disorders? This would be a kid who's diagnosed as hyperactive. They want to put him on Ritalin. But when you talk to the teacher or the parent gives you feedback about what the teacher says, they say, you know, he's a good kid. I like having him in class. Sit still. He just can't stop shouting out the answer to the question. That's, we say, lack of impulse control. But the clue here is that he's cooperative, generally wants to be participatory. He's a nice kid. He's not biting the other kids. He's not, troublesome in that way. He's not aggressive. This lack of impulse control tends to be due to heat rising. And this heat rising often is due to a lingering pathogen. You look at this kid, you find swollen lymph nodes, you find some kind of chronic sinus problem, you find reactions, or you find a history of some kind of, they had a bad infection in the past, or really severe flu, or something like that is a clue. Maybe this kid was treated with antibiotics for quite a while for something. There's some suspicion in your mind that there's this lingering pathogen. It's this pathogen generating the heat, and that's where the Xiao Chaihu Tang really fits the case. It has that surfacing and cooling and yet tonic harmonizing quality. And so it helps push the pathogen out of the body. I've had so many kids like these kids but compare that to the kid, similar presentation, lack of impulse control, shouting out answers, can't sit still, this, that, but now we start to see the aggressive tendencies. This shows that the liver is hot itself. It's not just some heat rising from a pathogen. The liver itself is hot. That's what creates the aggressivity. A real clue to this is biting. Kids who bite other kids or something, that's a real sign of liver heat. I wonder why. The gallbladder meridian traverses the jaw, has to do with grinding of teeth. Somehow it comes out in that. If we correspond the individual teeth to different organs, the canines here are the ones that go to the liver. Kids with liver stagnation have trouble losing those baby teeth. They often get doubled teeth right there where the adult tooth comes in beside that baby tooth. And it's always that one, or on the bottom. And that's a sign of liver stagnation in that kid. So that, tooth sticking up. They always say, if you can raise your gum right there like that, that's a sign of liver heat. Like, you can do it. Uh-oh. Yeah. Don't make her mad now. Liver fire is going to come out, But some people just can't really do that very well, Your dog can do it, though. Dogs are very yang natured, right? They can always lift that that too. So this is where instead of Xiao Chai Hu Tang, we use something like Chai Hu Jia Lang Gu Muli Tang. Xiao Chai Hu Tang evolves to this by adding the Longu and the Muli, heavy minerals, downward action, very settling, and this formula has some Da Huang in it. So it purges out the heat more aggressively. And so you should think of that also in your point selection. I need to move more aggressively when the problem becomes more emotionally aggressive as well. So I have to attack that heat more. So you can use, in this first kid, you know, you don't need to use points that have an actual purging effect. Whereas in this case, yeah, you can use stomach 25 and stomach 36, 37, and 39 together, really having that downward eliminating action. Yes?
How long do you keep kids on these formulas?
You have, you know, if I want to generalize about an answer for how long to keep a kid or an adult on a formula, you have to think two things: the nature of their problem, and then the harshness of the formula. So, for example, if we mention a formula like Chai Hu Jia Long Gu Muli Tang, generally I would say that that's a fairly mild formula, despite the fact that it has some Da Huang in it. It's not a high dose of Da Huang, it's not extremely purgative, and they could take it for a while, a couple weeks, something like that. At some point, you may decide, oh, I need to drop the Da Huang out of the formula. Or I need to give it in a form where the Da Huang isn't very purging. For example, tinctures, powders, in those prepared in some way, the Da Huang loses a lot of its laxative effect. And so I find, like I often give kids herbal extracts. And herbal extracts of this, the Da Huang is not so physically purging, and they can take it for a long time, 3-4 months, and not have a negative from that side of it.
So you see it fixing the problem?
Definitely.
And then they're good.
They're good. That's my goal. Always. I mean, my goal in treatment is always that. You can't always achieve it, but I never like to think with the strategy of maintenance. I like to think, how can I change the body so it's self-maintaining? So in the kind of problems we've been discussing, do I build the spleen enough so they can take care of the pathogen that's remained in the body? Do I drain away that heat that's congested in the liver? And then they should be able to, you know, and that's often a question of changing your strategy as you go. Often once the symptoms are better, you've treated the overt complaint they have, then we have to think about, do I need to do something else by way of long-term maintenance for a little while to keep the digestion strong, or to help them keep building yin, and you know, like, and often make a change wherever I would say maybe on an average over the first couple of months, I'm focusing on the symptomatic complaint, and then after that time, doing more just supportive treatment. Like, for example, I'd like to do a lot of things like spleen tonics that they take with meals. Or maybe take qi regulators first thing in the morning, just to keep the qi moving well in the daytime. So if a patient tends to be weak in the digestive area, spleen tonics with meals, they tend to be moved towards easy qi stagnation. They should take a qi regulator in the morning, one of these formulas that just circulates. They tend not to have very good sleep. Take a Shen calming formula just before bed. Something like that, just addressing that aspect of them that will stabilize them over the longer term. My teacher used to say, it's better to treat the person for the more obvious things first. This is in contradistinction to a lot of stress. There are those people that say, you've got to go for the root. You always have to look for this deep, long-term pattern. The symptoms are sort of distractors in a way, and they want to see who this person is and then focus on that deep issue. My teacher, my family tradition was exactly opposite to that. My teacher would say, this person comes in, they got some symptomatic level. That's like the big elephant in the room. Treat that thing. You know, treat that, focus on that, and when you see that change, then you can pay attention to longer-term, subtler issues. And I've just adopted that approach, and I find that a very helpful strategy for me. It's a lot easier for me, rather than trying to recognize a subtle, hidden thing, you know. And my teacher used to say, oh, you know, it's almost like a disrespect to the person to look past their symptoms. The body is choosing, that person is choosing to display themselves in a certain way. That's their main symptomatic presentation at that moment. They're having symptoms there. That's meaningful. So we treat that first, and that sort of starts getting and then it's so much easier to treat the long-term thing. I've found personally, I don't know your experience, but if I try to ignore that and go for some root thing, it's going to take a really long time to make balance from there. But if I treat the symptoms, I can often get change in that right away. And then already they're, you know, so that's in response to your question about how long. Target the symptomatic thing, be a little aggressive on that, and then on the lunch break, there was some discussion of traumatic brain injuries and post-traumatic stress disorders and stuff. I think this strategy is very applicable there. You look at the cognitive deficits and all that are occurring as a result of that traumatic brain injury, and just target that, you know? And you often see some pretty quick changes then and then it's the question of the longer term support. So you're going to have to, you know, keep the blood stagnation moving in the brain. You know, in traumatic brain injury, a lot of times it's water accumulation, not blood stagnation. Because it's been my, because I observe that work, it's been my suspicion that when the blood doesn't move, the fluids don't move either. And I bet in a modern sense, it must say something about changes in cerebral spinal fluid pressures and stuff like that. And so a lot of your herb formulas that regulate the fluid channels of the body make a big benefit in those people who have had these chronic low-grade traumatic brain injury things, like Wuling San and Zhuling Tang and those kind of herb formulas, and then similarly the points like spleen 9, so important for those patients. Similarly, we see this in kidney disorders and the like. A lot of times we're getting the fluid regulation in the body really stops that internal wind from happening. So what's the choices there? You've got here again, sort of thinking of your cases. Who looks more like Wuling San? Wuling San, usually there's a little bit of some qi or yang deficiency. Zhuling Tang, more yin deficiency. Right, that's an interesting formula. I said we were going to see a case about that. There was an interesting case of insomnia treated with Zhuling Tang, put forward from the Song Dynasty, and it's startling to people because they say, "Oh, isn't Zhuling Tang for urinary tract bleeding?" Actually, Zhuling Tang is the first of the big yin tonic formulas. Zhuling Tang, again, we can make our Bermuda Triangle here, has Zhuling as the emperor. The name of the formula is Zhuling, showing that this is the emperor of the formula. And then it has Ejiao, and then it has Hua Shi, Tauk. Right? These are the three big things in the formula Zhuling Tang. People say this is for urinary tract bleeding. By the way, this formula is great after prostate surgery. It is for urinary tract bleeding, and people recover a lot faster and have a lot less side effects from their, if they do transurethral prostate resections and things like that. This is like kind of a must prescribe. You just give them this. This formula combined with Xiao Chai Hu Tang, great for abnormal cells in the bladder. Like sometimes you'll see blood in the urine of unknown origin, and the Western guy scopes the bladder and says, "Oh, there's like abnormal cells on there. It's a precancerous condition." Blah blah. You give Zhuling Tang and Xiao Chai Hu Tang mixed, those abnormal cells disappear. I had a case I learned this, and then I had a case not long ago of a young guy, Navy, sailor and started having blood in his urine. They, of course, passed him off for a long time, saying it's some kind of infection. And he took antibiotic after antibiotic with no change in this blood and urine. Finally, they finally scoped him and found these abnormal cells in the bladder and told him, oh, this is serious. But they didn't offer any specific treatment for it. You know, they only made him afraid. And so that's why he was looking for some kind of alternative. Oh, they told me that this problem, I'm probably going to have bladder cancer, and there's nothing really to do, you know. Yeah, so I learned this particular combination. I can't say I understand exactly why Xiao Chai Hutang is so important in that causing the disappearance of the, you know, we can speculate that, you know, this, as we described this formula, it balances somehow by tonifying and clearing at the same time. But we can understand a lot about this formula of the Zhuling Tang. It's actually the same sort of dynamic that we find in later, more famous yin tonic formulas. You have a formula that clears pathologic water. I mean, an herb that clears pathologic water at the same time as you have an herb that tonifies yin. Really is important because one of our chi mechanism things is when the body isn't building yin, it's building bad water. Or when it's accumulating bad water, it can't build yin. And you have to kind of target both things. So I would say in see, like these traumatic brain injury things, you're accumulating bad water from the trauma, the blood doesn't move, the water accumulates, and as a result, you're getting yin deficient, so you get anxieties and these kind of low-grade heart heat issues that come out at the same time. And so this formula is great for that. It clears the bad water, it builds yin, and the Ejiao also regulates blood. Weird thing, isn't it? It's a black donkey skin glue, you know, and because black donkeys are really yin, and then you cook their skin and they're concentrated with lots of water. Then the water, they say, is really yin, comes from the deep well water is what you want to use.
What you will substitute the Ijao?
Any of your like Shu Di Huang or Shen, you know, again, we often have in our modern discussion, Shen Di Huang is more for blood heat and Shu Di Huang is more for yin tonic, but they are really pretty close. Can't digest Shu Di Huang, have no problem with Shen Di Huang, so I think you can sort of interchange those. But that's sort of the plant equivalent. I think it sort of feels like Jiao to me. You know, so if you have a vegetarian person or something and you didn't want to use, but it's not an endangered species by any stretch. It's just a donkey and I mean, I have 3 mini donkeys now, so I love donkeys suddenly, you know, so it's not like I'm being cavalier about eat the donkey skin. But this formula is important to understand that it's actually, yes, it helps urinary tract stuff and stops bleeding, but in a way that's almost incidental to what the formula really does, which is get rid of pathological water and at the same time build the yin. And so this is so this gives us that idea that when we have water accumulating in the brain area, we might want to use something like this to restore that normal pressure balances and all, and at the same time calm the heart down. And then, of course, we see the exact same thing in Liu Hui Di Huang formulas and the like. They use the same idea. There's some clearing herbs, there's some yin tonic herbs there together. And so you want to do the same thing with your points. You can use it. Normally, for urinary tract disorders, we use something like spleen 6 and 9 and kidney 7. These points together open the water channel. In this case, we'd want to add something like kidney 3 to build kidney yin. At the same time, not just get the water out, but also start to build the yin. How about, here's a lady, a patient I thought of. She's 37 years old. She just went back to college. She has a couple of kids. They were old enough now. She felt like she could go back to school. So she's gone back to college at age 37. And she comes in and says, you know, it's been really exhausting to her. She's gone to school again. She's still trying to take care of the kids. She's exhausted. She feels like she can't sleep very well now. She's always nervous and worried about her study. She gets into this thing about worried about whether she's not paying enough attention to the kids now that she's distracted with so much study. I bet you know patients like that, right? That's a common presentation. So she's 37 years old and feeling like that and all of that. Her pulse was kind of thin. Her tongue is a bit pale. You would say perfect case for Guepiton, right? Her age is actually a clue, right? 35, the spleen starts to decline. Now she's trying to go do some memory work. She's going to go to school again and study, you know? And now she has that classic caregiver thing. She's trying to take care of the kids and feels like she can't do it enough. And then the goes along with that sort of obsessiveness of the spleen. Somebody mentioned a person like that earlier, you know? You just have to have everything just so. There's two kinds of just have to have everything just so. One is liver stagnation. People with liver stagnation need that. They start to they want everything just a certain way. That's the only way they can relax. So things have to be in their place. Everything has to be orderly. Everything has to be done. That's different than, oh, I just have to do it as well as I can. That's a different kind of perfectionism. The spleen perfectionism is, if only I'll study a little bit more, I'll finally be able to do it good enough. That's I'm sure you know that pattern. That's a spleen deficient person. Not like, oh, I can't relax unless everything. The liver type perfectionist person is content to yell at other people to clean up the environment. Clean this place up, then I can finally relax. That's a liver type. The spleen type, oh, I'll just stay up a little longer getting everything organized. That's the spleen type. You know, totally different. So the Guepiton is the perfect example for this. And as is often said, helps build memory of facts. Hence, it's the pre-test formula. Because in building the spleen chi and cultivating the heart blood, now that we saw that E is in that character for memory. It's particularly that kind of memory of facts. It's not for Guepiton is next to you senility type memory loss and stuff. That's not that. It's also no good for, I can't remember why I went into the next room, or, oh, I'm always forgetting my my stuff that I need to take to work with me, or whatever. Those are not spleen memory issues, and Guepiton doesn't match that. But it matches, what the heck did that guy say about treating, this disorder? I can't remember which formula that was. It's for that kind of thing. So, by way of differentiating, we have the Guepiton person. How about very similar symptoms, still the sleep disorder, still a little restless and agitated, but maybe even their pulse could be a distinguishing factor. What if instead of having a somewhat weak and thin pulse, they have a more full or bounding kind of pulse? Or maybe we'd say a flooding sort of pulse. Then we need to connect heart and kidney. That's the classic Emperor's Tea presentation, Tenwan Bushindan. And so the person is restless, can't sleep, a little agitated. And there, instead of seeing the weak sort of qi deficiency pulse, we see this more full and flooding pulse. We see yang flushing up as a result of the lack of kidney being able to keep control on things. And so, points-wise, the first patient, we're going to bladder 20, spleen 2, spleen 3, like that. The second person, we're going to connect heart and kidney. Bladder 15, bladder 23, heart 3, kidney 3. That kind of heart. So it's a sometimes very subtle difference in the clinical presentation. Who's the Guepiton type? Spleen qi deficient, heart blood deficient. And who's the Tenwan Bushindan type? Heart and kidney not connected. Now, what is something that can disconnect the heart and kidney? Shock. So when we talk about post-traumatic stress disorders, I find that to be a very important pattern. Reconnect the heart and kidney for those folks. Their heart and kidney gets separated. Traumatic events are particularly prone to disconnect the heart and kidney. And that can then be imposed on other longer-term patterns. So the person comes in, they may look like a lot of different things. Deficiency here, excess there, liver stagnation with heat or whatever. And yet, somewhere in their mixture is this lack of connection between heart and kidney, which gets disrupted by the traumatic circumstance that they were in. And so we always have to think of reconnecting heart and kidney. And we can do that with points. We can do it with, our herbal formulas that have that tendency to go to the heart and kidney. That differentiation between those two is sometimes a little subtle. Now, we mentioned the Xiao Chai Hu Tong type of presentation, where it's the kid with the chronic pathogen, right? I actually had an adult patient who, interesting case, was a young woman. She was 27, something like that, and she had a job. Was working in a theater, and she felt that it was a really stressful thing. She was in the costume department and this and that, and she really didn't like workers. She felt it was just so stressful. Always, I guess she was the, what do they call that, the dresser or something, like between the scenes. She was the one who had to get the stuff to the actors. They had to change their costumes and all this and that. And she had just a couple seconds to have everything and the performers would yell at her because she wouldn't have the things at the right, So it was like that kind of, and so she has that background stress going on. She really felt like, I want to quit this job. But it's hard to find a job in her field of wanting to work in the costuming department. She had studied costume design, and that was the background. She says, so anyway, I eventually decided I can't stand it there. I'm going to quit anyway. And her family got mad at her, put a lot of pressure on her that she was quitting this job in blah, blah. So she has all this background, and suddenly she gets this really severe ear infection. And the ear infection goes away with some antibiotic use, but after that, she can't sleep. She felt nervous and anxious, kind of chronically fatigued. She felt like she couldn't concentrate. Here's an example of an adult with that same lingering pathogen kind of pattern we so often see in kids. And again, Xiao Chai Hu Tong was great, not only because it helped clear the pathogen, but in regulating all that background stress that the liver had been accumulating. So after about 3 or 4 weeks on Xiao Chai Hu Tong, she was feeling, I feel so much, I could concentrate, I could think again. It phlegm sort of heat that was generated by the lingering pathogen, but the ear infection was a clue. And of course, the other thing was she had still palpable lymph nodes under that ear that she had had the ear infection on. But her complaint when she came in was, I can't concentrate, I can't sleep. It was easy in a way to recognize the pathogen because I asked, when did this start? And she retells me this whole story, of having them. And don't we say often taking antibiotics, while good for the acute infectious aspect, do lead to more lingering pathogen kind of problems.
So she stayed with her job?
No, her family gave her a hard time. Then she got the ear infection. Makes you think about, doesn't it, how we say sometimes ear stuff is when you don't want to hear something, Because it's unusual for an adult to get an ear infection, even when they're overtired and overstressed and the immune system's a little depressed and they catch something, an external pathogen, it often doesn't settle in the ear. What makes pathogens gravitate towards the ear? 3 possibilities. One is food retention in the stomach, very common in kids. They eat foods that don't digest easily, and then that backs up, and that's so with kids we often see that. The second cause for ear infection is heart fire, because the heart controls the whole of the ear, not the hearing mechanism, but the whole of the ear itself. So often we see inflammatory things develop in the ear after some kind of heart agitation thing. And then the third one is kidney yin deficiencies. Kidney yin deficiencies, overtired, overstimulated for a long time or something, you become vulnerable. Those are the three possible causes for ear infection. Kids are prone to all three of those things. They have that like all going on at once, so they're very vulnerable there. Adults are a little less vulnerable, but I didn't want to hear something.
Gallbladder in ear.
The gallbladder in ear is, yes, it's true that the gallbladder meridian traverses around the ear, and the gallbladder does accumulate some damp, but that's like sort of your one-off occasional ear infection thing. It penetrates. I don't see that as a predominant cause for ear infections, nor things with the triple warmer meridian. Even though we use triple warmer 3 in treatment a lot, I would say those three things I mentioned are what I see as the sort of underlying vulnerability pattern.
So heart fire would be more the emotional component of it? This is what you're saying?
Yes. Yeah, heart fire is the emotion. It makes a tendency for heat to accumulate around the ear. You know, I mean, think about it. When you treat ear infections, well, although yes, we use Xiao Chai Hu Tong for the lingering pathogen aspect, but in the acute throes of an ear infection, I seldom use gallbladder treatment like Wendan Tong or even gallbladder meridian points. All that, okay, locally maybe. I use gallbladder 2 or something nearby, but really, you know, what do we use? We use triple warmer 17, but that's a lot, I think, because of its local effect on the lymph drainage there, and it's a wind point. I don't think it's because it's really triple warmer meridian that much. But what really works for recurring ear infections, between the infections, you burn moxa on kidney 2 and kidney 6. Then they don't get the ear infections anymore because you've built up the yin. And, of course, we change their diet. You know, again, I hate to, I'm always going off in the peds direction, but when I first studied pediatrics in China, back in, I don't know, say 1980 or something, I was in China, and the doctors there said, well, let's talk about, because, you know, back then, a lot of times you were working with doctors, they never dealt with a foreign student before. So they were like, well, let's talk about what you see in your practice and stuff. And I said, I want to talk about ear infection. They're like, oh, we don't see that very much. Let's talk about something important. Well, how about torticollis? I'm like, torticollis? I don't see that. I mean, yeah, you do see, but I don't want to talk about torticollis. I want to talk about ear infection. They're like, well, we don't ever even look in the kids' ears. It's like it wasn't. Nowadays, forget it. You go in, that's a big thing. Why? Because the diet changed a lot. Yeah, 1980, nobody was eating dairy products much, and the kids especially, wasn't that available. Now it's just like here. When in 1980, it was ration. And not only dairy products, oil, cooking oil was ration. You know, now, it's just like here. So everybody's got the same amount of ear infection. So we can really track that. See that food retention aspect that's so important there, you know. And of course, we can do points, and we can give herbs to clear food retention. Let me say, as an aside, I mentioned Xiao Zhenjiang Tang a minute ago, that minor construct the middle. That formula also works for colicky kids a lot, if they fit that presentation. It really. Xiao Zhenjiang Tang, minor construct the middle formula. I just thought of it there, thinking of these diet things that the kids get. But let's go back now to. No, let me do 2 more cases. As I said, I tried to create these cases for our case distinction. How about Xiao Chai Hu Tang? How about Tourette syndrome? Is that a mental disorder? Probably. That's a weird phenomenon, right? It definitely has physicalized components. Modern medicine doesn't understand the mechanism really at all. They treat it as a seizure disorder. They try to use anti-seizure meds generally. But, of course, from our side, this is wind accumulating, right? And it creates first physical tics and then all these vocal tics and so forth, right? Start shouting out. These kids, typically if you see a kid progressing down this road, they'll start with physical start with a lack of impulse control, and then they get to where the vocalization starts. They start making sounds, if it really progresses, they start shouting out words and so forth. Right? So it's this movement like this. So there's clearly some kind of wind. But in the what's very instructive for us is in the early stages, they have lots of physicalized chi stagnation. They will have tight muscles, very tight neck and shoulders and so on. And if you relax them physically, it really dampens their tics and stuff for a while. And so Chinese medicine tends to define this as liver chi stagnation with heat rising turning to wind. The wind harasses the Shen. That's when the vocalizations start. And so when it's physical, it's just liver. As it goes towards vocal, its heart is involved as well. So now we think about what can we use? I like the formula Igansan. Restrain the liver power. And you might say, well, what's the difference that? You've talked about Shao Chai Hu Tong. We also have Shao Yao San, all these famous liver formulas. Igansan is just kind of like a sort of Shao Yao San, but it has Gotong in it. It pulls down the wind part. So it's regulating the liver and pulling down the wind. And so that's a good formula for that kind of, and it makes the person more relaxed, more physically relaxed, regulating the qi. It has a little bit of, it does have dongwei in it. It has a little blood tonic aspect. And it gets, if there's enough blood in the liver, that helps to subdue the wind also. And my teacher used to say, not only is Igansan good for kids with this kind of Tourette's thing, it's good for people who get kind of neurotic behavior. Now, what does that mean? You know, here's my Korean teacher whose English was practically non-existent, and he's saying neurotic behavior. He was talking about people who have sort of odd behaviors that they sort of always like to indulge in. Very picky about certain foods, like their environment in just a certain way. So people who are like that, not so much obsessive in the sense of they need to do repetitive things, they need to straighten the fringe on the carpet, that kind of OCD, but more like, oh, I don't eat that. Oh, I don't like that. Oh, I only want to be like this. Oh, you know what I mean? They're very uncomfortable in their environment, and they need to always sort of manipulate their situation to be, I only eat these kind of food. Oh, a new food, that kind of sort of behavior. He saw that as an element of wind in the body. It produced that sort of kind of funny, always.
Not open to change.
Well, there is something to that. They don't like new foods or new things, or they know it's going to be bad. You know, I know I'm not going to like that. You know, I don't even have to try it. You know.
Would you say it's more a matter of control or more a matter of needing to be indulged?
I would say in this context, it's probably more a matter of control, because that feels like the liver thing to me. You know, so yeah, they don't want to get into a situation where they feel out of control. So new things are threatening. You know, it's like, how could I possibly like that? I never had it before. Well, how could you know? No, I can't. You know, so that's not OCD. You know, that's. So Igansan was his formula of choice for that, and I must say, again, I learned so much by the see this, do that kind of method. I use that formula a lot in those kind of patients, and it really is helpful. Very simple formula. Again, you could take it for a long time. It's sort of still in the harmonizing class of things where it's got some tonics, it's got some movers. You don't worry about taking it for a while, and people just sort of start to be more okay in their environment. And you see this, a lot of kids like this, right? The kids who are on the mono diets. Always makes me think of other mono diet where you're like really picky about foods could be spleen deficiency, adults or kids. So, but here, as Andrew said, this feeling of wanting to be in control. You know, I've noticed a lot of these patients, they need to feel like they know everything that's going on. They're the ones who drive you crazy in the clinic. Well, what's in that herb formula? Could you print something out for me? Where can I look it up on the internet? Like that. Then they come back and say, oh, I saw this herb and I found a study that interacts with, and is it really safe to use? Oh my goodness, you know? I know everybody's laughing because you get those patients, right? It's just unnerving. You know, they just feel so insecure with the circumstances. They're out of control with that. Well, that's an Igan-san type of reason. Now, you asked the question about the gallbladder. What's the difference between an Igan-san person and, say, the Wendan-tan type of person? This warm the gallbladder, or, well, of course, that formula we know is not about warming the gallbladder. It's really mostly about unblocking the stomach and not letting phlegm obstruct things so much, right? This person who needs the Wendan-tan is usually more withdrawn. They're not so outwardly engaged with, you don't see the wind part. They're not coming out with, I'm not doing, blah, 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 blah. They're withdrawn more, and that's where you want to use the more phlegm clearing aspects. And you can look at where the phlegm is located. If there's evidence that the phlegm is in the middle, Wendan-tang is perfect. If it's actually in the upper part, Bansha Hoputang, our formula we often talk about for plum pit sensation. But that's considered a very psychically active, and a formula, by the way, I use in post-traumatic stress patients a lot. Kind of what you see there is the person's type, you know, they're more chi deficient, they're more heat or what, but then Bansha Hoputang regulates that phlegm and moves chi in the upper part and really helps clear the person's thought a lot of times. So again, a very simple formula, very safe to use, easy to prescribe. And of course, because it regulates the throat, the hupo regulates the throat, it's good for all kinds of things that obstruct vocalization. Like people who have voice problems because they're stressed out. Like, I've got to give a speech today and I'm losing my voice. I think I have laryngitis. That's a situation. It's an actor, terrible stage fright, and that it affects their voice. Bansha Hoputang for them.
So you move a little bit fast between Wendan-tang and Bansha Hoputang.
Wendan-tang it unblocks, and it unblocks at the stomach level, kind of. So it's more in the middle, whereas if it's in the upper part, Bansha Hoputang is more upper. You know, Hopo goes to the upper warmer more. We even use Bansha Hoputang in chronic asthma. Right. And really what it's doing is, again, if we start to make that sort of triangle thing, on one pole you've got the Bansha, on the other pole you've got clearing phlegm and clearing chi stagnation. So it really unblocks that area. That's why we use it, as I said, in asthma too. Chronic maintenance for asthma, we can use a Bansha Hoputang. Not for treating that somebody's in an asthma attack and their face is blue and their lips are purple. It's not for that. It's not strong enough to do anything there. But here's a person well controlled with meds, wants to use their inhaler. Last one, Bansha Hoputang, you can use at that time, and it just keeps that hidden phlegm that's causing the airways to swell. It helps keep that from accumulating. Bansha. It's on our list of formulas. So, of course, your point selection, you know, again, I know a lot of you like to get the sense of how to do the same things with acupuncture. Your point selection has to follow that pattern. This formula regulates chi and clears phlegm. So it's regulating in the upper part. So which point do we have in the upper part for clearing phlegm? We have pericardium 5. Pericardium 5 clears phlegm in the mind, clears phlegm in the upper part in general. We might go to a lung point that clears phlegm, like lung 7, lung 8, you know, even lung 5, good choices. Lung 1 is a really good choice for clearing phlegm in that region. If it's even higher, stomach 8 clears. Then we can support that with stomach 40, and then we have to move the qi. Remember our combination 40 and gallbladder 34. We're going to see, as we go through some of these other herb formulas, they use a lot of dananxing in mental disorders with phlegm. You may know that dananxing is tiannanxing treated with bile, because it makes it more phlegm clearing. You know, yes, it changes the temperatures, but mostly it makes it break up that phlegm accumulation in a stronger way. And we do the same thing with our points. Gallbladder 34 and stomach 40 together, really clear. Way, your question about the gallbladder is a good one, because a lot of times as a support to transforming phlegm, even if the problem is not gallbladder per se, activating the gallbladder helps clear that chronic phlegm condition, because bile cuts phlegm. So my teacher used to say, stomach 40, gallbladder 34, that's treating stomach 40 with bile. It's like making dananxing out of tiannanxing. It's going to penetrate that hard nodule now of phlegm that's obstructing somewhere. Okay, so that was a few cases I had thought about, just some differentiation. Let's go now and look at our, keep pressing through our packet here, and you see our next page was, we're on page, 14, is that right? Here we now have a list of the traditional disorders that we can find in the classic text. So I just want to quickly go through. We're going to go individually through these in some more depth. But depression, we have the classical term of of stagnations or accumulations also, or something like that. In fact, Shudan Shi, who we mentioned, our master, great master of the Tonify, the Yin school, lists the different kinds of obstructive factors that can lead to this stagnation of qi, stagnation of blood, stagnation of food, stagnation of phlegm, stagnation of water. You have that list somewhere in your packet, but that's one kind of depression. More often, we see this discussion of withdrawal, where the person is drawing the Shen inward. Withdrawing the Shen inward can often be caused by excess, not just the deficiency. And then mania, where the person has, and so this starts to give us, and within these first three things, we start to see the basic patterns of Chinese medicine. We have hysteria is really high affect, really outward moving, outward acting kind of. So this hysteria is an agitated organ. They talk about is a kind of young, outward moving upsetness, and often occurs. It's apt to use the Western term hysteria because it often occurs in women premenstrually, in menopausal women, and so forth. And so there was a classical debate. Were they talking about when they talk about agitated organ, they didn't specify in the classics which organ. Some say they're talking about the uterus, heat in the uterus. Some say they were talking about the heart. And hysteria fits that thing. But anyway, we can say that there are disorders of low affect. Low affect disorders where you're withdrawn, depressed, and so forth. Disorders of high affect, like or hysteria. And then we have the disorders of confusion. And so they say these are the three primary categories for mental disorders now of Chinese medicine. All the things where you're depressed, withdrawn, or forgetful, or sleepy a lot, and you see the list goes on here, lazy. They distinguish, interesting, isn't it? Laziness was considered where a person didn't work enough. Again, judging by their outward behavior. This person just lazy. That's a mental disorder. You know, that would all fit in this low affect kind of, and usually we say deficiency is present. So stagnation, blocking, and giving a false kind of appearance of deficiency. So the low affect disorders are usually caused by deficiency or stagnation. The high affect disorders are usually caused by heat. Could be empty heat, but heat is the main target. things like anxiety disorders. Oh, notice there's a disorder often discussed called MOMO. MOMO is, they translate it as taciturnity. Again, it's a kind of not caring about something, just with, you know, I don't give a damn about anything kind of thing. You know, it's not like, oh, I feel depressed, but it's just like, whatever, you know. So there's that Lilly disease, that Baha disease, mentioned a kind of a restless agitation and so forth. There's running piglet, that kind of flushing up of anxiety. You know, those can be in that high affect heat disorder. And then there's the confusion stuff. And this usually has phlegm as its underlying component. The phlegm obstructs the normal function of the mind. Can also have blood stagnation, can also have water problems, like we mentioned, the post-traumatic stress or the traumatic brain injury or something where there's water blocking the mind. They often use that term, water amassment. There's water accumulating and it can't move. So that produces the confusion aspect. And then there are things like schizophrenia would be a strong example of that kind of manifestation. Where so these are our three basic categories, and then these named disorders sort of plug in there according to the symptomology.
Could you repeat what you described as Lilly disease?
Lilly disease is a kind of a low-grade anxiety. And as I said, the initial description of Lilly disease is the person can't find a way to be comfortable. They feel like, oh, maybe I'd like to lay down, but they're restless. They feel like, I'm hungry, but no, I don't eat these foods. So they can't find satisfaction and comfort in any way. They're always just uncomfortable and restless. And it usually is some kind of heat harassing the heart. Typically, you use the lily, the Baha, to constrain that heat back down, and then it's combined with something. For example, it's combined with germu if you want to direct the heat back to the kidney. So it's sort of like empty heat coming up from the kidney harassing the heart. It's combined with shurgao if there's a lot of heat in the stomach or something. It's sort of almost like a yang ming heat. So they'll combine the Baha with wherever that heat, whatever the source of that heat is, producing this sort of low-grade, always uncomfortableness. That's Lilly disease. As opposed to running piglet, which is strong, upflushing anxiety with physical. And that's why they often say running piglet is anxiety attacks, whereas Lilly disease is low-grade, uncomfortable kind of anxiety. So you have to think, now right there, you say, as I say, the basis is there's deficiency, or there's heat, or there's phlegm, but running piglet can actually be cold accumulating, and they say the cold pushes the chi up. So it doesn't always, not every case is perfectly fitting in this simple patterns, but in the running piglet is that upsurging chi. We'll look at that disease and say we're going to go through these things a little bit more, but just wanted you to have a sense of what are the diseases. So people who say Chinese medicine doesn't really have mental disorders per se are really a little bit simplifying. When you see all of these were named disorders in classical texts, they recognize all of these things happen to people. And notice sexual dysfunctions, lack of sexual excitation, orgasmic disorders where the person can't orgasm. Those are all discussed classically. They're not just modern things. Now, next page, this one, the discussion of the 4 C's. I chose to put this in next because I want to emphasize one aspect of the 4 C's, which is the C of marrow, the brain. The 4 C's include the C of marrow, the C of blood, the C of chi, C of water, and brain. The C of marrow is basically the brain, and maybe a little bit the spinal cord and like that, but it's mostly the brain. So when we talk about disorders of the C of marrow, we're talking about the brain is not full anymore, and it gives rise to all kinds of things. Sleep disorders, very commonly. A lot of your brain injury kind of things, seizure disorders, that can often related to this sea of marrow not able to fill. And you'll see so many patients, like with, say, a seizure disorder, and you treat for the wind, you treat for even a seizure disorder that follows a trauma. You may have seen that, a person's been in a car accident and then begins to have a seizure disorder afterwards. And they say, oh, it's brain trauma has produced that. And so your normal thinking is, well, I got to remove the stagnation from the trauma to stop the wind from being generated. But if you don't nourish the sea of marrow, the brain never heals right. It normalizes. In fact, I can think of my first independent pediatric case. After I had separated from my mentor and started my own practice, I had the first kid that was brought to me was a kid with seizure disorders from having fallen from the changing table. Isn't that a classic thing? His mom dropped him on his head, you know, and started to have seizures. And they put him on Dilantin, and the Dilantin worked. Stopped having seizures, but also stopped development, right? Because Dilantin really blocks normal mental development. So, of course, his parents say, isn't there something else we can do? And the doctor's like, no, he's controlled now. We can't change the level of Dilantin. So she comes to me, and I think, well, you dropped him on his head. See, this is an example of interacting with people. You don't say it like that, right? That would, you know, no use increasing the guilt level any more than the... But I'm thinking, well, she dropped him on his head. I'm going to give things to move blood stagnation. So we have, you know, like Shui Fu Zhuyu Tang, for example, is a typical choice for this. And then I'm going to pull down Win because he's having the seizures. No result. Every time we tried to back down to the Dilantin, boom, the seizures would go off again. So finally I break down and call my teacher. You know, he's like, he can't yell at me in front of the patient now, but he yells at me anyway on the phone. Didn't I teach you any better than that? What's the matter with you? Blah, blah. Okay, now finally gets there. He says, the problem is you're clearing the excess, but you didn't treat the deficiency, which is the child's brain has been damaged. You have to fill the sea of marrow. Put him on Jing tonics. Dang, as soon as we added that stuff in, I added turtle shell and deer antler. You know, use that formula. What is it? Guelu Artian Tang. It's the deer antler and turtle shell 2 immortals formula. It's only got four herbs in there, something. Let's go chiza in there. Seriously, but it tonifies, really nourishes the brain. You know, dang, if that I still kept him on for Win, but I put that in off the Dilantin, no more seizures. And my teacher says, you know, didn't I teach you better than that? You have to fill the sea of marrow again. So that's why we should always be aware of the brain is involved in these mental disorders, and it is part of the sea of marrow thing. The next one is important too. The next sea is important too, the sea of blood. The Chongmai is the sea of blood. And if we look ahead, well, I don't know ahead, page 8, this is ahead. Page 8, we see there is this pathway starting at the bottom, going through the legs, the kidney, the stomach, the qi in the center, the spleen, liver, the heart, lungs, the brain, the shen. So we could actually put in here the hun and the po. And this pathway is the Chongmai. If this pathway isn't functioning, then of course we're going to have all kinds of disturbances, especially the shen at the top, and the brain is on the way there. Right? We can actually look at the we said that we have the 3 treasures of the Shen, the Qi, and the Jing, and it goes through the physical body. Notice how the Chongmai has that branch that goes down from stomach 30 along with the stomach meridian down into the legs, right? It's connected there. It's bringing the Jing up from the Dantian. It connects with the stomach meridian. Goes on up through the heart. It's how the heart communicates with the reproductive organs. Goes all the way up to the head. Goes around the mouth. So not only is the brain part of the sea of marrow, we also have this sea of blood going up. And so we have to make sure that the Chongmai is regulated. You know, think about, this is an interesting point as well, that people don't know what to call this Chongmai. I don't know what you've read translation. People say penetrating vessel, or what other choices do we have? Yeah, but for that term Chong, when they call that the they try to translate, because nobody knows exactly what that character Chong means there. So people make guesses about, well, let's translate it this way, because even in Chinese, people don't know exactly what that Chong means. If we look at the character itself, it actually implies something about splashing water. Like when you throw water, my language teacher explained it, it's kind of like when you have water in a bucket and you throw it, splash it out like that. That's what that Chong really implies. So penetrating, that's not exactly that, you know. It's so it implies something about this kind of upward splashing thing. So my teacher suggested perhaps that's why it a lot of mental disorders. It's like some kind of splashing up of the mind, of the substances in the body, something like that.
Like a geyser?
Like a geyser. Oh, that's a kind of a cool. Yeah. Anyway, so we have this Chongmai thing that we want to regulate as one of the 4 C's. So now let's go back here to page 6 and see what are some of the points we've got for this. For the C of marrow, yeah, we've got all those Jing tonic herbs. And by the way, Shi so often discussed as a phlegm clearer for the mind, also seems to it seems to be somewhat tonic for the brain too. So I would say yes, your Jing tonic. Notice they're animal substances a lot of the times, deer antler and turtle shell, and then Shi those 3 herbs are really going to benefit the brain. And then our points here. Do16 and Do20 are the 2 classical points for the C of marrow, but also Do23 or Do24 are really important, kind of coming to the front. The Shen Kong points around Do20, and then Do26, especially if there's blood aspects to the brain dysfunction. Do26 regulates the blood in the brain, which is probably why it helps you to recover from fainting, because it opens the circulation back into the brain. But similarly, it's good for benefiting the 5 senses. Do26, if you have, as we see in elderly folks, they start to get diminished vision and hearing and such as they're aging. Do26 really helps that. It refills the C of marrow with blood, and people will say, oh, it's not so much for like, I'm now getting farsighted, like me, you know, I'm like, oh, I have to wear my glasses when I read now, you know, that's not Do26. But older folks, when they start to have, you know, macular degeneration and things just don't look as clear, that's when Do26 is a useful point to include. Did you see that Red Cliffs movie that's out, you know, the famous battle at the Romance of the 3 Kingdoms in China at the end of the Han Dynasty? There's a movie out called Red Cliffs. It's a nice movie. It's worth watching if you get a chance. I'm sure you can rent it on Netflix or something. Is the Red Cliffs it's called? And if you do it, get the original Chinese version rather than the one. They're both subtitled, but they made a shortened version for the Western market. The original one, it's two volumes. It's really fun to watch. But anyway, there's a character in the movie who's expert in the death touch and can like block people. Point. And there's a funny scene where it's a woman, by the way, and her lover is injured in a battle, and she rushes out onto the battlefield, and she's pushing Do26 in the movie. It was so cute too. So anyhow, so we've got these points for Ben, and so all these things, learning disorders, dyslexia, sensory dysfunction, residue of head traumas and stuff. I always want to regulate the C of marrow, and especially if the patient is a child or elderly, becomes even more essential. The C of marrow is always getting empty when you're old. And those of you that have studied peds with me know that I emphasize this. Children and old people with sleep disorders, you have to do this sea of marrow treatment. Even when the elderly person comes in and appears to you to be yin deficient, and you think, oh, this is the classic yin deficiency, can't sleep, I'm going to give them yin tonics. It's often hard to treat those. But you know the old people that tell you, I wake up at 3 in the morning for no reason and then I can't get back to sleep and I'm tired all day? And so you give them yin tonics till the end of their life and they never sleep good. Start filling up their brain again. Well, that also can be a sea of marrow problem, and you have to. But then you're instead of giving them yin tonics, you're often giving them chi tonics or clearing. About oversleeping, those are the two big things there. Chi deficiency or damp accumulation often makes oversleeping, and of course those often happen. The chi doesn't help you. You're not digesting. You're not transforming the damp, and then of course when you have that's one of our. This is way back on page 21. These so-called pivots are actually the dynamic of the chi machine that we've been alluding to all day. We're saying there's a chi machine in the body. And we talked about the yin and wei, the interior versus exterior with the Guizhi Tang. We've talked about the Shaoyang just a little bit indirectly because we mentioned Shao Chai Hu Tang. It's the formula for when things get in that middle layer. But look way down on the bottom of your list is part of our chi machine is chi is in between damp and yin. And when you are accumulating damp, usually because the chi isn't working well, you start to run out of yin. Because damp is bad quality yin. That's why we had in a formula like Zhuling Tang, you had to get rid of the pathological water. It's why we have those same herbs in Liu Hui Di Huang Wan. We have to get rid of pathological water in the process of rebuilding yin. So people who have damp easily go towards yin deficiency at the same time. So that's where it starts to look like a weird presentation. Seems to be tired, seems to have chi deficiency, and then they start to get restless and agitated at the same time. Here's a tired person who can't sleep. They have damp. How about big overweight people who have a small red tongue? They have lots of damp accumulated, and they have dryness on the interior. It's exactly, they have spleen chi deficiency, they're accumulating damp, they gain weight just looking at food now. They don't even have to eat anymore, they gain weight. And yet they're yin deficient on the inside, and they drink like crazy. It's because this aspect of the chi mechanism is disrupted. And this often is the pre-diabetic condition. So we often talk about diabetes as somehow a wasting of yin, but for a lot of this type 2 diabetes, it's not that. It starts out with chi deficiency of the spleen and damp accumulating, and the person gains a lot of weight, and eventually they run out of yin, because now they don't make a good yin, they make all kinds of damp for themselves. So yeah, eventually they get yin deficient. They do fall into that thirsting and wasting pattern, but the initial stages are more damp accumulated. So this is an important dynamic in the body for our chi machine, is to keep that balance between, we got to get the chi transforming the damp back into high quality yin substance again. What helps you transform things into yin? Feeling valuable. People who don't have self-worth don't build yin. And so, of course, as a person goes towards yin deficiency, or if a person doesn't feel valuable, they damage their yin. We've got to think of, that's where, again, our interaction with the patient, how can we interact with somebody in a way that makes them feel self-worth again? I find, really simple tricks often work, like getting a pet. Oh, that's a really effective yin tonic for a lot of people who lack, because first off, animals give them this love no matter what thing, so then it's necessary for them to care for the animal. That's a really helpful yin tonic, and often much better than just putting them on yin tonic herbs or needle and kidney 3. You're creating a sense of self. They have a function in life. very easy in our modern circumstance, especially when the economy gets bad, for this issue to come up. Because people lose their job. They often feel not valuable anymore. And especially you get, where I've seen this in my clinical practice in more recent times, is people in their 50s and stuff lose their job. And they often say to me, you know, I don't think I'll ever work again. I'm too old. Nobody's going to hire me for that. And any job I could get, I'm already overqualified. I can't go to. I'm not going to go to work in a McDonald's now. I'm 50-something. You know what I mean? I've been a professional. And that's and those people really start to lose yin as a result. So we can say that the circumstantial issue of losing their job that was what gave them a sense of self-worth for a lot of. I've been lucky that way. I never tied my self-worth to my work. I mean, that's again, everybody has their nature that they're dealing with. I mean, my problems don't go in that direction, I can always make myself feel valuable. I have a million. My problem goes the opposite direction. If I have yin deficiency, it's not because I don't value myself. It's because I think the only way to be valuable is to be overbusy. I don't have any shortage of finding ways to do that. So you have to recognize you're dealing with me as a patient. I want to have a totally different dynamic. I don't need to get a pet. I already have 6 horses, 3 donkeys, 6 chickens, 3 dogs. I don't know why I have these 6s and 3s going. I keep bees. I even have a worm farm. And we got the worm farm, thinking we're going to feed them to the chickens. I never do that because I like to talk to those guys. I lift that lid on the worm farm and they're all wiggling in there. I'm putting food in. So now I take care of my worms. Like I don't see them. So you have to see, that's a different kind of person, right? A different dynamic. So,
Does it still fit under the category of Shen disturbances?
It's definitely a Shen disturbance. He's kidding, but it is, isn't it? Because if I'm going to, what happens to me, I either get exhausted or hurt myself. Right? Because I can't, it's not in my nature to say, oh, I'm doing too much, I'm taking on too many things, I need more time and space. That doesn't, because what I have, the misperception I have is what makes me effective and valuable and makes life rewarding and makes me feel successful is by doing lots. That's my dynamic. So you have to recognize that about me. If you're going to be a clear mirror, I come in for treatment, I'm like, I need chi tonics. And you say, you don't look like that to me. I go, yes, I do, because I got all these things to do and I can't keep up. That's my delusion, right? That's, you recognize that. Whereas somebody who's really attached to their work and loses their job, it's a different, I would never feel it. I'm fired. Oh, great, now I have more time to do more things. That's and people like that, right? They fired from their job, they're finding another thing to do. They make money. They never seem, have you noticed that? Some people, they always have trouble having enough money in their life. Other people, I have friends. I never really saw them have a real job. And if they're traveling to Asia and they're doing all, I'm always wondering, how do they do that? Exactly. But they have a way. Because their nature is different, right? So you have to recognize the dynamic of but this whole digression comes from the fact that lack of self-worth is tied to our yin, or self-worth is tied to our yin. And as the person becomes yin deficient, they experience lack of self-worth. And if we can recultivate that, they can start to build their yin again. But can you see, this aspect of our chi machine is so important for mental disorders. Even things like really psychotic disorders, schizophrenia easily falls from this pattern because the person's chi is not transforming, damp is accumulating, the damp blocks the mind, and the person gets delusional thinking. And then, as the yin becomes depleted, that delusional thinking comes outward as empty heat. And they start to act out. They start to have paranoid delusions, for example. They have yin deficiency of the kidney. Fear comes up. It comes outward. And they're raving to you about the spacemen visiting and those, like I'm thinking of a particular patient who, she's always on about that. And she's so clear about seeing these alien visitors and this and that. And now, if she didn't have Shen Disorders, attending these UFO conferences, right? And lecture. I have a friend like that. He's actually a retired fireman, was actually head of the EMS department in Baltimore for some time, and like that. So this guy had a totally functional work life, and he is a regular speaker at UFO conferences and has this whole. You wouldn't classify him as Shen disturbed, even if you thought, well, it's a little odd that he's really convinced of all the. But this lady who comes to me as a schizophrenic patient, it's a totally different manifestation of seeing aliens in her environment and all of that. And the more yin deficiency, she has that red tongue with a pointy tip, has like dry white phlegm on the top, you know, that dry white greasy kind of, not greasy, but you know, like blobs of dry stuff. That's clearly the phlegm has the yin dryness now, the dryness and the empty heat is drying that damp, creating these phlegm nodules. She can't get past these schizophrenic thoughts. So so in her case, yes, we can clear phlegm and damp. Yes, we can give her yin tonics. We also have to tonify the qi, so she starts transforming in that. Can you think of an herb formula like Bansha Tianma? What's that formula for damp in the mind, damp in the head? Bansha Baiju Tianma Tang. Yeah, that formula is really kind of matches. You see, it's got the Bansha, it's got the Baiju, and the Tianma is yin tonic and takes down from the head. It sort of fits her pattern.
So in a lot of cases, schizophrenia will have its onset in late adolescence or early 20s. In some cases, people first notice it when they go off to college.
Yeah.
Is there a correlation, you think, with the age of onset? Or?
Yes, that's and as I said a bit ago, one thing we want to look at is the stage of development in life. Often helps us understand onset of particular mental disorders. Well, hey, should we take a break for a couple of minutes? Let's take a break, and I'll find my overhead, and then when we come back, we'll go right to Andrew's question about age of onset.